This is Dr. Howard Rappaport. I am the director of our Zufall Dental Residency Program, head of faculty, and I'd like to welcome you to the Zufall Health and Delta Dental's Continuing Education Program. I'll be moderating this presentation. But before we start, just a few heads up. Please, all guests, stay on mute. We encourage you to ask questions. There will be a Q&A box in order to enter your questions. They'll be held to the end of the presentation. Be sure that your Zoom display name is your name so that we can verify attendance. To receive the CDE credit, you have to fill out a survey at the end that you'll find at the end of the presentation. You have a week to do that. You'll find that at zufallhealth.org/CDE. You'll also find links to upcoming courses. And what you're seeing in front of you now is a list of our past courses, all of which have been extremely valuable. After the course ends, you'll find a survey below Tamesia Alston's name on our CDE webpage, and the evaluation will be open for 1 week, and certificates upon that completion go out in 2 to 3 weeks. And I think you're in for a real treat and something very valuable from Tamesia Alston. So enjoy. Now I'm going to turn this over to our dental director, Dr. Jade Duncan. She has some information to share with you for those who are not familiar with the Zufall Health side.
Thank you so much, Dr. Rappaport. I am Dr. Jade Duncan. I'm the Senior Vice President of Dental Services here at Zufall, and I want to tell you a little bit more about us. So Zufall Health is a federally qualified health center in Northwest and Central New Jersey. We have been serving patients for over 30 years, and we were founded in 1990 by the late Dr. Robert and Catherine Zufall, who are pictured here. In 2023, we treated more than 48,000 underserved patients across 7 counties in the state. We want to give a big shout out to Delta Dental. Thank you, Delta Dental, for being our CDE series sponsor. They have been a longtime partner of Zufall, supporting clinical operations in our very early days to our Zufall Health Delta Dental Mobile Unit, as well as our Smiles for Our Heroes event that provides dental services to low-income veterans. They've been supporters of our new clinic space in West Orange that opened last year. The CDE Course series is one of a few of our current oral health initiatives. We also have a community dental health coordinator program that trains professionals to help patients navigate the dental healthcare system. And we also have our dental assistant training program that provides on-the-job training to participants right here at Zufall to help us address critical gaps in our dental workforce. Lastly, and this was just announced, we're excited to invite you to save the date for our Beyond the Smile Symposium this November 15th. Registration will be opening sometime later this summer, most likely in August. So please go on our CDE website, subscribe, and you will get notifications as soon as registration is open. So how can you get involved? We have a few opportunities for how you can get involved with Zufall. We always welcome your financial support. You can make a tax-deductible contribution to us through our foundation at zufallhealthfoundation.org/donate to support access to healthcare for our underserved patients. And next year, we'll be looking for volunteer providers once again for our Smile for Our Heroes event. And thank you for those that volunteered in our event last month. You can always reach out to AFAF now if you're interested in participating. And now for the reason everyone is here tonight, Tamesia Alston. Tamesia Alston, MPA, is the founder and CEO of Alston Management Group, LLC, a top virtual assistant agency for dental specialties. An advocate for equitable quality care, Alston has more than 20 years of experience in healthcare administration with expertise in revenue cycle management. She has worked with institutions including Duke Health, Northwestern Medicine, and Tufts Dental. Before founding her agency, Alston had held leadership roles including core functions director, coding operations manager, reimbursement manager, senior practice manager, and compliance auditor. She has a bachelor's degree in accounting from Ashford University, a master's degree in public health administration from DeVry University, and a master's certificate in healthcare management from the New England College of Business. Alston is certified in Epic CDM and in dental and medical billing, coding, and instruction. Tamesia, I'll turn it over to you. Thank you so much.
Thank you, Dr. Duncan. I'll go ahead and share my screen. Are you able to see my screen? All right, so let's go ahead and get started. I want to talk to you all today about mastering the art of dental coding, but more specifically, let's get into unlocking the power of accurate documentation to get your claims paid. So again, welcome to the webinar. My name is Tamesia Alston, as Dr. Jade mentioned. I am really excited to share this information with you in hopes that you'll be able to benefit and use it immediately following this presentation. So today we're going to talk about things such as what is dental coding. We're going to talk about the importance of documentation for dental coding, proven medical necessity with your documentation, how coding fits into the revenue cycle, as well as talking about the importance of auditing the revenue cycle workflow. And then I'll also go into some case studies as well. So a little bit about the background. Let's talk about what specifically is dental coding. When it comes to dental coding is the transformation of oral healthcare diagnosis, procedures, and services into universal alphanumeric codes. The diagnoses and procedure codes are taken from the dental record documentation. So the American Dental Association, or ADA, has developed a comprehensive set of guidelines for dental coding known as CDT, or as you know, current dental terminology. And that CDT manual is updated annually, and it's available, the updates are available every January 1st. One thing I will say is it's very important to have an updated CDT manual so that you'll have any updated codes, any revisions, and you'd also know the deletions for the year. If you are a provider that also participates in medical coding or diagnosis coding, you also want to ensure that you have the current manuals for that as well. When it comes to the importance of dental coding is crucial for so many different reasons, such as accurate reimbursement, compliance, coordination of care, data collection, patient care, and quality reporting. Dental coding in the healthcare industry ensures accurate reimbursement for services. So you want to ensure that the treatment that you are providing to your patients, you're being reimbursed properly for your time and the work that you're providing. You want to make sure that with your dental coding and documentation, you're maintaining compliance with regulations. There are coding guidelines that we have to adhere to. There are federal and state guidelines. So you want to ensure that your documentation and your coding aligns with that. And then it also streamlines the billing process. So when it comes to dental coding, it enhances patient care by providing clear and consistent records, and support sufficient resource allocation within healthcare facilities and dental practices. So additionally, when it comes to dental coding, we are also talking about facilitating data collection for research. When it comes to public health, I know one thing that has been big is documenting the social determinants of health. That is big across dental and medical. And it's something that as a coding educator, we are trying to spread the word so that we can ensure that we're capturing that in documentation so that we're able to collect data on those social determinants for not only the medical side, but dental as well. And then when it comes to policy making, it's also crucial. So it also aids in quality reporting and performance measurement. Being able to report on what we're doing year over year, being able to compare the trends is very important to the work that we're doing, especially in surrounding public health. So by improving communication amongst healthcare providers, payers, and stakeholders, dental coding plays a vital role in the overall efficiency and effectiveness of healthcare delivery. So when it comes to dental billing and coding, they are both important components of the healthcare revenue cycle. A lot of times I find that providers think that billing and coding are one and the same, but they're two completely different functions. The two main processes include the translation of the oral healthcare services into billable codes, that's the coding side of it, and then the preparation and submission of claims to insurance companies for reimbursement, and that aligns with the billing side. A lot of times when you have a dental biller and coder, it's one person doing both functions. However, when you move into medical billing and medical coding for dentistry, there are two distinct functions, and a lot of time the billers do not understand coding guidelines. So it's really important to understand that they're two different functions. And then coding is central to the revenue cycle, and that spans from the patient registration all the way to receiving payment for your services. So here's just a snapshot of dental revenue cycle. It starts with that initial phone call. So revenue cycle starts when you have that first intake with the patient all the way through to the time that that claim is paid in full. So whether it's scheduling, registration, whether we're talking about insurance verification, which is integral to this process, coding and charge capture, when we're talking about medical records, claim submission, even collecting the patient's co-payment, as well as the insurance payment, and then, wrapping that all up, tying it all together and making sure that that patient encounter is at a $0 balance. That's the entire revenue cycle. So when it comes to steps to dental coding, claim submission, and follow-up, I have a few steps that I feel are integral to the process. So one thing that you want to always do, and which we'll get into it in detail, is you want to document thoroughly. You want to include your thought process in your documentation. One thing I find that as healthcare evolves, one of the things that we are seeing is everyone talking about oral healthcare and how it impacts overall healthcare. So whenever you have documentation, and even if you are submitting it to dental, but let's say, for instance, your patient doesn't have dental insurance and they want to tap into those medical benefits, they may request documentation. And so what I'm going to talk you through is documentation that meets dental and medical guidelines so that you are able to be reimbursed, but not only you, your patient as well. So document thoroughly. You want to identify the procedure, making sure that you have the correct procedure code by looking at the CDT or CPT code set. So you want to look at your, double check, cross check your manual or either, your EHR, because I'm sure that information is up to date as well. One thing I will say as you go into the new year, you want to make sure your EHR has the most up-to-date codes. I will say if you are reporting diagnosis codes, those change in October. So you want to make sure by October 1st of each year, you have the updated diagnosis codes in your system. As it relates to the code as well, you want to make sure that you are matching the procedure to the code. You want to look at your documentation. You want to make sure that documentation supports the code that's being selected. I know a lot of times we have ancillary staff that are selecting the codes, and so you just want to be sure that the codes that are selected actually support the documentation. And then you want to check for code updates, making sure that you're always submitting the most up-to-date codes so that you aren't getting denials for coding. And then you want to look at specifics. If you're looking at billing medical, you want to make sure that you are billing to the highest level of specificity if you're using diagnosis coding. And then you want to make sure that if there are any modifiers on the medical side that's warranted, which I won't get into for this presentation, but you want to make sure those are added because those can lead to denials as well. You want to make sure that you verify with your insurance provider any narratives that are needed for procedure codes or any attachments required. So like if you're doing a perio scaling root planing or you're submitting a code, a crown or a bridge or an implant, you want to make sure that you verified what needs to go with that initial claim. That allows the processing of the claim to happen with the clean claim. You're able to be reimbursed quickly versus having the insurance company send you a correspondence to say they need documentation, they need a narrative, they need perio charting, they need pre and post-op x-rays. You want to make sure that you have that information up front and you submit it with that initial claim. And then you also want to look at, after submitting the claim, you want to make sure you review your rejection report. One thing that I noticed is that a lot of offices don't realize there's a report that's generated after you submit claims to let you know if it was a clean claim that was submitted or if your claim had errors. If your claim has errors such as registration, it could be, date of birth, you want to make sure that those are corrected and resubmitted immediately. One thing I will like to add is that whenever you have your office team, your office administrators verify benefits, you want to ensure that the information that the insurance has matches what you have in your system. I know in systems such as Dentrix, there's a birth date field, and because a lot of times what we find is insurance may have one date of birth for the patient that may be incorrect. However, when you submit your claim, if you submit the claim with the patient's corrected date of birth and that's not what the insurance company has, then it will be rejected. So there's a field in the EHRs that allow you to put the insurance date of birth, which may differ from the patient's actual date of birth. And then you want to follow up on claims. You do not want to allow your AR to just run rampant. You want to make sure that you have a system in place whereby you're following up periodically to ensure that your claims aren't rolling over from 30 to 60 to 90 to 120 plus days. So having a workflow in place whereby your team is following up on claims until they're paid, responding to any notices of correspondence that you are receiving from the payers. A lot of times, claims are not paid because no one is following up on the correspondence that's sent to the office. And then you want to consult with colleagues or resources if you have any questions about the process, and stay educated. Continuing education is key when it comes to revenue cycle. So ways to maximize reimbursement. You want to keep up to date with federal and your state's laws and rules. You want to read your insurance contracts carefully. And for instance, you want to make sure that a lot of providers don't realize when it comes to your insurance contracts, if you bill an insurance, you have to bill your patient. If you want to give your patient a discount, then you also have to discount the insurance or notify the insurance company up front. Otherwise, it's a breach of your insurance contract. You also want to have a detailed verification of benefits. I cannot state this enough. Verification of benefits saves a lot of time when it comes to the denials as well as the rejections. When it comes to rejections, that means that the claim hasn't even reached the insurance company. So no claim number is assigned. And when you have a denial, that means the insurance company accepted the claim. However, there was some type of error on the claim and they denied it. You want to make sure, again, you're using the correct codes, you're submitting adequate documentation and attachments, again, reviewing that rejection report, scrutinizing EOBs for errors because insurance companies make errors as well. So you want to make sure that you are reviewing the explanation of benefits, the remittance advice that you receive, and you are responding accordingly. And then appeal denials for medically necessary treatment using positive language. So the coding resources that you have at your disposal. For dentistry, you have your CDT, your current dental terminology manual, and coding companion. And then on the medical side, we have 3 manuals. We have the CPT, HCPCS, and the ICD-10 manual. Again, medical manuals include the oral cavity. I tell providers all the time that are tapping into billing medical for dentistry, the medical manuals include the oral cavity and procedures of the oral cavity. You just have to be able to tie it to a medical condition and document how it impacts the patient's overall health. So going into the coding resources, again, we have the CDT. That's the current dental terminology that's owned and maintained by the American Dental Association. The codes in the CDT manual are 5-character codes that start with the letter D and are used to be they used to be in the dental section of our HCPCS medical manual. So if you're familiar with the HCPCS manual, which lists the supplies for some procedures, it was actually it came into play because of Medicare, CMS. But what the HCPCS manual doesn't include is a section with the letter D, and that's because it was carved out, and that's how we have our CDT manual for dental. So most dental and oral procedures are billed with the CDT codes. However, now a lot of times I'm seeing dentists are billing the medical payers as well. And then the ICD-10 codes, the International Classifications of Diseases, includes codes for anything that can make you sick, hurt you, or kill you. So it's a 69,000 plus code set made of codes for conditions and disease, poisons, neoplasm, injuries, causes of injuries, and activities being performed when the injuries were incurred. I know on the dental side, we're able to use the ICD-10 now on our claim form. And what it does is it proves medical necessity, or it helps to prove medical necessity, because for each code, it tells you why you provided that treatment to the patient or that service. And then again, we have the HCPCS and CPT codes, CPT manuals on the medical side, again, that are able to be used by dentists. So let's go into documentation, and let's talk about why documentation is so important for medical necessity. So documentation is a cornerstone for quality healthcare. It provides a roadmap for patient care and ensuring continuity and accuracy in treatment. Documentation, I cannot overstate the importance of documentation. It's used for continuity of care, for legal protection, protecting your license, reimbursement, compliance, research and education, as well as quality improvement. So for the importance of clinical documentation, it goes far beyond just patient care. It plays a crucial role in many aspects of healthcare delivery. Thorough and accurate clinical documentation is essential for providing high quality care, protecting you legally, ensuring proper reimbursement, and driving continuous improvement in healthcare delivery. So when it comes to documentation, your documentation should tell a story of why the patient needs to be seen and the impression or decision for next steps. It includes all pertinent discussions with the patient. Could be a caregiver that you're discussing things with, a parent, a spouse. You want to include that in your documentation, any findings, any summary of counseling that you provided. All of that should be documented in order to assist with supporting the service that you are coding and sending out to insurance. And then documentation is essentially a provider's proof of thought. So exactly what were you thinking as the patient came in, the patient told you what's going on, all the way through to your decision making and your treatment of the patient. Most providers have an inherent knowledge of what should be documented for clinical standards. However, there's a gap between the clinical standards and the coding systems and published medical necessity requirements. So most providers document reasonably well for dental care, but are unaware of the details needed for accurate code selection for billing, reimbursement, and quality measure purposes. So when it comes to medical necessity, this is what every insurance company wants to see. Is the treatment that you're providing to the patient medically necessary? One of the most important requirements to receive payment for services is to establish that medical necessity. You must justify care provided by presenting appropriate facts within your documentation. So payers require the following information to determine the need for care: knowledge of the emergent nature or severity of the patient's complaint or condition, documentation of the signs, symptoms, complaints, or background facts describe the reason for care, and the facts must be substantiated by the patient's healthcare record, so your documentation. And that record must be available to payers on request. So if a payer wants to request a record just to help with the reimbursement process to identify whether the treatment's medically necessary. Let's say, for instance, you did not provide a narrative up front, so they're requesting documentation. You want to make sure that it's readily available for you to submit so that it speeds up the adjudication process and you're reimbursed. For example, if a patient complains of pain on the upper left, by number 15, and the provider performs an x-ray which shows extensive decay requiring an onlay, when the claim is submitted, the payer needs to know why the service was performed. So the narrative on the dental claim, or it could be a diagnosis code on the medical claim, that supports the medical necessity of the treatment. That indicates the reason for the procedure. So one of the things that I have found that helps with proven medical necessity and speeding up reimbursement is the documentation. A lot of times I find that I see some dentists are using a SOAP note. More and more dentists are using a SOAP note, but some dentists aren't using a SOAP note. But I want to go into the SOAP note, because it's critical. If you are ever interested in billing medical payers, it's a good time to invest in learning how to document with the SOAP note, and perhaps adding templates within your EHR for this. So the SOAP note acronym stands for subjective. That's the information provided by the patient. What's the signs? What are the symptoms, the feelings, concerns that the patient's bringing to you? We want to document that. Objective would be the measurable data that's gathered during the examination or your diagnostic test. Then you do your assessment. You're providing a professional assessment of the patient's condition, including a diagnosis if available. And then what's your plan, your treatment plan, your proposed plan of action for further evaluation, treatment, could be medication, follow-up, or referral to another provider. All of that should be included in your documentation to prove the reason for the visit and why you selected a certain course of treatment. So notes are structured to ensure a systematic approach to documenting patient encounters, allowing for clear communication among healthcare team members and supporting continuity of care. So when we're looking at the subjective section, you want to make sure that you're stating that in the patient's own words. You want to document the patient's description of their problem or their concerns to provide clear understanding of the patient's experience. You want to be thorough and specific, capturing all relevant details about the patient's condition that you're treating, including any pertinent negatives in chronological order. So if the patient says, hey, this pain has lasted, it started a month ago while I was, chewing a piece of ice. You want to make sure you include all of that in your documentation because it builds the story of why you are selecting a specific course of treatment. And it's proven that it was medically necessary that you provide that treatment to the patient. You want to record any patient concern, any patient expectations. You could also include any lifestyle factors, and you want to use open-ended questions whenever you're discussing it with the patient because it encourages them to have comprehensive responses for you. And then, of course, you just want to review and clarify with the patient to ensure that your documentation is sound. When you get to the objective section, that's where you're going to include your exam findings, your vitals, any kind of results, your x-rays, diagnostic data. And then the key tips for documenting in this area, again, is being precise and detailed no matter what section you're documenting. You want to make sure that you're always recording the vital signs because it provides critical information about the patient's current state. And then describing abnormal findings. Any abnormalities that you find during the exam, you want to document, as well as the documentation for any diagnostic test results using chronological order when you're documenting a series of tests or x-rays over time. So if you want to do some type of comparison, you want to make sure that you speak to what was done maybe 6 months, 12 months ago versus today. And then you want to review and update as new data becomes available and maintain objectivity. And then when it comes to your assessment, you want to ask yourself, does my documentation clearly delineate my proof of thought? Have I provided a plan of action for every assessment provided? Because a patient may need, treatment in every quadrant. A patient may need a crown. A patient may need full mouth scaling. So for each plan that's going to be on your treatment plan, have you provided detailed documentation about assessing the patient's condition? Are there outside determinants that are complicating your assessment? It could be when it comes to perio, maybe you can't have a full assessment until you remove the tartar. You want to make sure that all of that's included in your documentation. And does your documentation use any uncertain diagnoses or descriptive words when documenting, like probable or suspected, or it's consistent with? You want to make sure that if it's a definitive diagnosis, you aren't saying probable, because probable to an insurance company means that you're not sure that's what's going on with the patient. And that's really important whenever they're reviewing your documentation. And then when it comes to your plan should tie everything together. So the plan, your treatment plan, should tie together what happened as a result of you seeing the patient in your documentation, and not just what you're giving the patient as the treatment plan, but I mean in your documentation. any further investigations that are, going to be warranted based off of your examination and your discussion with the patient. What are your options? There are times that patients may have options. You want to document what those options are and what the patient selects versus what the patient doesn't select. Any referrals, prescription drug management, you want to make sure you're documenting. If you recommend that your patient take some type of medication or supplement, want to make sure that's documented. Even if your patient says, you know what, while I understand the need for that, I maybe want to hold off on, that supplement or taking this medication, you still want to document it, because especially on the medical side, they take that into consideration. And when we are billing out, for instance, for an exam, let's say you have an oral exam and we're billing it to the patient's medical insurance. Even if you recommend treatment or you recommend prescriptions and the patient elects not to move forward, they will give you credit for that. And then any prescribed therapies, patient education, you want to make sure you document that, as well as the frequency the patient is to be seen for follow-up. And again, note this hints at the severity of the problem. So you want to make sure that you're outlining what state your patient is in. Is it severe? What will happen if the patient foregoes treatment? If you're recommending that the patient get a crown and the patient decides, not to schedule that appointment, in your documentation, you advise the patient if the patient elects not to move forward with treatment, that it could turn into a more serious treatment plan. So a patient not returning for a year likely has a less complex condition than one who is seen frequently. Could be and it could not be, but it could indicate that a condition is stable. So if in your documentation that you have that the patient will just follow up in 6 months and you're going to put a watch on it, the insurance company is going to look at that documentation. Providers should consider incorporating the SOAP format into their documentation for different reasons. So of course, the organization, the SOAP note provides a detailed level of organization for your documentation, and it makes sure that you capture everything from the patient's perspective all the way through your exam, your thought process, all the way to your treatment plan and treatment. It also has that comprehensive assessment with the subjective, objective assessment and plan structure, allowing you to conduct a thorough evaluation of the patient's oral health care status and treatment needs. It gives clear communication, whether it's communication to your team, whether it's communication to another provider that you refer the patient to, a patient request on their medical records. It's clear to the patient. It's also clear to the insurance companies. You want to make sure that the payers are able to understand the medical necessity for your treatment. And then also when it comes to clinical decision making, the structured nature of the SOAP format helps dentists analyze patient data, make informed clinical decisions, and tailor treatment plans accordingly. And then, of course, when it comes to the legal protection, proper documentation in the SOAP format serves as a detailed record of the care provided, which can be essential for legal protection, case of disputes, or malpractice claims. I always tell my providers, I want your documentation to be to serve as a level of defense for you. If you're ever audited, if a payer ever, requests documentation, I want you to protect your license by having good documentation. So I want you to remember, a well-documented SOAP note is not just a record of a patient encounter, but a roadmap for providing effective and comprehensive care. When it comes to auditing operations, One thing I will say, kind of moving from the documentation to auditing, it's very, very important that any process, not just your documentation you want to review, but any workflow within your practice, you want to make sure that workflow is audited. So auditing, as a compliance auditor, I will say that the OIG has a work plan, and it's not just the OIG, it's the payers. They have specific things that they target year to year, certain procedure codes that they will audit. If you bill a certain procedure code, let's say you're tapping into billing medical payers for oral health care procedures, and you're always billing the same level of evaluation and management. No codes ever are different. That may trigger an audit because is every case the same? I had an instance where a provider started, billing to medical payers, but they really didn't understand the difference between dentistry, which has one specific code for every evaluation, versus medical that has a range. So you have, level 2 up to level 5 based off of the condition of the patient and the documentation, what it supports. But they were billing the same level, the same codes for everyone. And they called and said, hey, I'm being audited. I don't know what I did wrong. And that's exactly what happened. They did not understand the way medical works and how the leveling of the evaluation and management services or the examinations were different. So always be careful with that as well. So auditing is essential for every aspect of your operations, like I stated. So including revenue cycle to ensure accuracy, compliance, and efficiency. Regular audits help identify and rectify discrepancies, optimize processes, and maintain adherence to regulatory standards. By thoroughly auditing all operational areas, organizations can enhance financial performance, reduce risk, and improve overall operational integrity and accountability. One thing I do for all of my clients is I make sure I do periodic audits. And what I do is I bring forth an audit summary whereby I document any trends that I'm finding. So when you are auditing your office operations, you want to make sure that you have someone that can document and bring forward any trends they're finding, whether it's, are you auditing maybe your revenue cycle and you're looking at all your rejections. So then as a follow-up, you're going to bring forward, these are the reasons for the rejections, and you want to make sure that you have some type of corrective action in place so that you can ensure that that doesn't continue to happen. If you're auditing documentation and you notice that provider A within your practice, documentation is missing key components, you want to make sure that you have a one-on-one with the provider and give them that feedback. So auditing, an auditor's responsibilities is going to include reviewing the record. So we're going to review the entire record for documentation to support the CDT code or any codes that you're selecting, and the coding and billing processes after the claims have been submitted. So as an auditor, one thing that I'm going to look at is, does your documentation support the code that you want to submit to insurance? If it doesn't, we need to bill what you have in your documentation. One rule that we learn upfront as a coder is, if it wasn't documented, then you cannot code it. And that's just very important. The other thing is, you want to routinely run frequency reports for code utilization compared to national, state, or specialty benchmarks. You want to do that comparison. Where do you fall in comparison to other practices of the same type of practice, same size practices within your area? You want to develop reports related to audit findings. You also want to identify coding and documentation deficiencies that cause financial impact, such as overcoding and undercoding. You want to analyze data for mischarges. I cannot tell you enough how many times I have reviewed documentation and noticed that, sometimes codes have been missed. I remember reviewing one record recently where a patient had a bridge as well as a lot of crowns, and some of the crowns were actually missed whenever they added it to it wasn't on the patient's ledger, and therefore it didn't get submitted to insurance. So just being sure that you provide those audits to make sure that you're capturing all of the work that you're providing to patients. And then you want to provide education based on audit findings to your staff, as well as to maybe you have other providers in your office. So I have a few case studies. This one is in regards to documentation. If you didn't document it, it did not happen. So let's say, for instance, John Doe, he came to your dental practice for a routine checkup and minor dental work. Over the course of several visits, Dr. Smith performed various treatments, including fillings, extractions, and a root canal. However, Dr. Smith did not properly document procedures performed, the materials used, or the patient's response to treatments. And this is an example that I have seen myself. So these scenarios are real scenarios I just de-identified. So John Doe started experiencing severe pain and complications, which led to a second opinion. The new dentist discovered issues, still said the patient had infection, maybe a missed canal. And due to the lack of detailed records from that initial office, it was challenging to determine origins and specifics of the treatments previously administered, complicating the new dentist's plan to provide effective treatment. So as a result of redoing treatment, John Doe's insurance denied the claims from the new provider, leaving him with a high out-of-pocket expense. And as a result, he ended up suing that ABC dental practice for medical negligence, arguing that the lack of documentation prevented timely and accurate diagnosis and treatment of his dental issues. He claimed the failure to document treatments properly directly contributed to the complications and extensive corrective work needed. So John Doe sought compensation for medical expenses, pain and suffering, and of lost income due to missed work. One of the things that I will say is if you have to, if your records are subpoenaed and you do not have the documentation, it's as though you did not provide the treatment. So again, if it's not documented, it did not happen. Another case, copying and pasting inaccurate information. There's a case, and again, this happens a lot. Two patients, may not be this exact scenario, but the copying and pasting happens. Two patients in a practice were seen back to back. A dental assistant copied and pasted notes from patient A into the chart of patient B, trying to save time, and forgot to go back in and edit the note when the provider ran over in the procedure room. So the provider left immediately after treatment for an important meeting, and the inaccurate documentation was used to submit a claim to that second patient's insurance. As a result, the billing team relied on that inaccurate documentation to submit the claim to the payer. And when the radiograph and narrative did not support the medical necessity of the code billed to the payer, the claim was denied. So as a result, the patient received that explanation of benefit from the payer, which caused him to lose trust in the office team. The practice had to addend the note and resubmit the claim, requiring additional resources and time. So again, you want to avoid copying and pasting information into another patient's chart. Providers should ensure documentation is signed off on prior to submitting the claim for adjudication. For me, I will not bill any treatment that the provider hasn't signed off on. When the provider signs off on documentation, that means I have verified that it is accurate, and what you're going to be billing out for me is actually included in my documentation. So it's very important that if you don't have that policy in place within your practice, you ensure that no biller, whether it's a biller on your team or an outsourced company, are submitting any claims without you first signing off on your documentation. And then not documenting as soon as possible. I know a lot of times practices have policies whereby you have to have your note in the system within a certain period of time. And I know that we have dental providers that are in practices and also working in facilities, hospital systems. And a lot of those hospital systems have like a 72-hour turnaround time for the clinician's documentation. So in this case, a clinician didn't enter a note into the patient's chart until several days after the visit. The delay meant that another clinician who was treating the patient in the meantime prescribed them a potentially dangerous medication. It happened because after seeing a patient just before lunchtime, that first clinician got sidetracked and didn't record his notes in the patient's chart. 4 days later, the clinician returned to work after a long weekend and noticed his mistake. He added his notes at that time and backdated them so that they would be associated with the day the patient was seen. However, during that time, during the patient's initial visit, the patient described uh, symptoms they were experiencing that were possible reactions to a prescribed medication. But in the absence of that documentation, there was another provider that saw the patient during that long weekend for follow-up care, and the provider prescribed a medication, the same medication. Well, because that initial provider didn't have the information in the system, that led to the provider not knowing that the patient had a reaction to the medication. So it's just really important that if you don't have a policy in place, that you develop that type of policy, so that any provider that's coming behind you knows what went on during your encounter with the patient, and it kind of supports that continuity of care. So I will tell you that whenever we send out this presentation, I have more slides that actually go into how we level evaluation and management services, especially if you are billing to medical payers. I will have that documented for you, but I know in a lieu of, for the sake of time, I won't have the opportunity to go over it, but I want to make sure that you have it, especially if your practice is one that is able to tap into medical billing for dentistry. But in closing, dental and medical coding, documentation and charting may not be the most glamorous part of jobs for you guys. I understand it's not something that you spend a whole lot of time on as you are in dental school. However, it is very important. It's how you get paid. And as a biller, as an auditor, as a healthcare administrator, it's very important that the work that you put in and day out, that you're actually reimbursed for it. So having a documentation, being able to have the policies in place in your office whereby your team is able to capture the correct coding, to submit, the narratives and the attachments, all of that helps with the revenue cycle process in getting you paid. So it's just very important. It serves as a critical foundation for ensuring high quality patient care, driving reimbursement, facilitating effective communication amongst the healthcare team members, as well as safeguarding legal and ethical standards within the practice. So that accurate and detailed documentation supports the continuity of care across different healthcare settings and providers, enabling the tracking of a patient's progress over time, and it plays a pivotal role in healthcare billing and reimbursement processes. While it may seem tedious, the effort invested in meticulous charting pays dividends in enhancing patient outcomes, reducing the likelihood of errors, as well as ensuring a smoother healthcare delivery process. So therefore, embracing documentation as a fundamental aspect of patient care is essential for all healthcare providers, as it ultimately contributes to the overall well-being of the patients we serve and the efficiency of the healthcare system at large.
Wow, thank you. I know this has been covered, but I have these questions. What are the key components that should always be included in clinical notes to support necessary treatment and prevent claim denials?
So you want to make sure, as it was detailed, I'll kind of go back to that SOAP note documentation slide. You want to make sure that you know, are painting a full picture and proven medical necessity. So you want to detail what brought the patient in, what's the chief complaint, what's the reason for the visit. Is there anything that the patient, any information, subjective information that the patient provided to you? You want to document that. The other thing that I'll say that I noticed that aren't in a lot of records is tying together, you know, what's on that patient intake form, what other conditions are impacting the patient's oral health care. Does the patient have diabetes? Because, you know, that there's a correlation between diabetes and periodontal disease. So if you have a patient that's in for perioscaling root planing, you want to make sure that you have that information in your, not just on the intake form, because that's not going to be submitted to insurance, but in your documentation. So you want to paint the full picture of, you know, what's going on with the patient. You want to tell the story. So what's going on with the patient, why you're seeing the patient. You want your thought process to be represented in your documentation. Anything that goes into that examination that helps you come up with your treatment plan, that needs to be in your documentation, because essentially what you're doing is you have to prove that what you're doing is what should have been the treatment that should have been provided to the patient. So if you're saying that the patient needs a crown, the insurance company is trying to determine, could the patient have gotten away with a filling? So do your documentation supports that? Was a certain portion of the tooth, missing a certain percentage? Why did you have to do that buildup? Was the buildup necessary? So you want to be sure for any procedure, you're detailing why you had to do it. That's how you prove medical necessity.
Another question is, what are the most frequent reasons for claim denials, and how can accurate coding help mitigate these issues?
So there are so many reasons that claims are denied. It could be incomplete or incorrect patient information. That would be more so a registration denial. I cannot tell you all how many times I've seen where the verification process is just not put together within the office. So it could be the patient's not covered, insurance isn't active, patient's not, a member any longer. Patient's coverage became effective after the date of service. A verification of benefit process would have deterred that denial from even happening. So you want to make sure that you have someone that's truly verifying that patient benefit. Could be missing or incorrect codes. Let's say, for instance, as I stated, every year your codes change. Let's say January 1st, the codes for crown, and this is just a hypothetical, but let's say, for instance, the code for a crown, has changed, and you're still billing that old code because you haven't invested in having that automatic update to your system, as well as having your updated CDT manual by January 1st, then you're going to get denials for the wrong code. I'm also seeing denials for a lack of medical necessity. Again, documentation drives medical necessity. Could be for duplicate claims. There are a lot of times I tell providers that when you have a claim that's denied, submitting a new claim doesn't get it paid. You want to pull the correspondence from the insurance company and see what they're asking you for, because until you submit that, the claim is not going to get paid. So when you resubmit a claim that was already submitted, it will deny for duplicate claim. And it could be that that claim had already been paid too, but that a duplicate claim is a denial that I see quite often. Also, if authorization or pre-estimate was required and you didn't get that authorization, it could be denied for that reason. It could be a service that's not covered for a particular plan. I've seen those denials as well. Timely filing is a big one. So if you have a patient that comes in and they are getting a cleaning, the insurance says every 6 months to the day, and you have the patient come in on a 3-month recall, then you will receive a denial. Well, no, I'm sorry, that is frequency. Timely filing is if you don't submit the claim within the timely filing guidelines. So for a lot of dental payers, it's a year. Let's say for you, for instance, you didn't submit that claim within a year. You notice that, hey, after I've done an audit, I uncovered that I never submitted this claim, and you submit it after that, that filing period, then it will deny for timely filing. Frequency limitation is the other one that I was just discussing. So if you have a patient that's on a 3-month recall, but insurance only pays for cleanings every 6 months, then every other cleaning will get denied for frequency limitation. And that should be discussed with the patient up front. So that's why that verification of benefit is very important. Also, coordination of benefits. We have a lot of patients that have multiple plans. You want to ensure that you know what's the primary and what's the secondary. Knowing that up front and submitting it in the proper order will save you from getting denied from patient having another insurance as primary. Also, it could be bundling or unbundling. So if you have, let's say, for instance, you have x-rays and the insurance considers, a payer considers a certain amount of x-rays as part of a FMX, and you are unbundling it and coding it as PAs or bite wings plus PAs, you could get that unbundling denial. So those are the common denials that I see in dentistry.
Tamesia, that was awesome. Thank you for being part of our continuing education program. So,
thank you for having me.
Our pleasure. Some other information. Please remember to save the date for Beyond the Smile Symposium. That's November 15th. Registration will open later this summer. More CDE courses will be announced soon. We encourage you to stay in contact with us. You can sign up for notifications about our other future courses if you have not already done so. As a reminder, to take the survey in order to get credit, visit our website of